Hi, I would like to demystify some osteoporosis myths for you. My name is Dr. Amir and I'm a physical therapist specializing in health and wellness. I recently spoke with the wife of one of our patients. The husband was receiving treatments for a shoulder problem, and during his therapy sessions, she would sit in the waiting room and read. Although she was just about 7 years old, she looked younger than 60. You know the type, lean, fast on her feet, active, never really had a health issue, but also somewhat unaware of health and wellness habits. She was genetically healthy in some ways, but as you will soon understand, she had some underlying medical issues that were not yet revealed on the surface. After about 3 weeks of her regularly accompanying her husband, during our typical pleasant and casual conversation, she appeared unusually worried and distant. After some exploration, she told me she was at her own doctor the day before and he wanted her to start taking medication for what she said was bone loss. Not only was it going to cost over $2,000 a year, he didn't know if it would reverse her condition, and she would have to take medication for the rest of her life. Imagine receiving that news, going from what she thought she had been a healthy person to being a patient, all in just a 6-minute doctor session. And by the way, 6 minutes is all the time he spent with her. No alternative to care, no emotional support, no real guidance. Unfortunately, this is an all too common scenario, and I don't even blame the doctor. I blame the healthcare system. Anyway, I sat with her for a few minutes and asked her to set some time to speak with me the next day, when I could focus on her issues without distraction. She came in the next day and we talked. To be honest with you, I was evaluating her as I was trained to do with many clients I work with. But to her, it was just conversation. In any case, we talked about her lifestyle, what she eats, how she spends her day, and so on. She confided in me that she was scared of all the things she read about bone loss online and has heard about osteoporosis. The weakness, the broken bones, the falls, the loss of balance and endurance. Most of all, she was worried about not being able to take care of her husband the way they were soon celebrating their 50th anniversary, or being able to hold her grandkids. Now, you all know the healthcare system is broken in many ways. As I mentioned before, I don't blame her doctor for not having time to sit and explain all of the medical options. Doctors don't get paid enough to sit and educate their patients. They get paid to prescribe and treat. This drives up the cost of care, which can be astronomical. There's not enough attention given to each person. Doctors generally wait for you to become sick rather than teaching you how to prevent illness. People spend money on aftercare without getting any benefit, or worse, getting even sicker from inappropriate health care. There's medical fraud, medical errors. I can go on and on. You have all experienced some or all of these things in your own life, or if you are lucky, only heard of these problems. But what if there was a better way? What if you can invest in your care and have lifelong, meaningful results? What if your investment in yourself paid off exponential dividends? First, let's go over some myths related to osteoporosis specifically. You may have been told that as you age, it's normal to have bone loss and osteoporosis. The truth is, you can have the effects of bone loss begin even in your 20s, but regardless, you can also prevent it virtually 100% of the time and reverse the effects starting at any age. Myth number 2. If I don't have osteoporosis, I am not at risk of breaking bones. The truth is that many people with the normal bone density test, the test that helps determine osteoporosis, do experience fractures. And half of those with a diagnosis of osteoporosis do not get fractures. So what gives? It can get confusing without proper assessment of each individual. The third myth: only drugs stop osteoporosis. This is the most damaging lie of all. Taking drugs is a fast and easy tool for doctors and big pharma. Millions of dollars are spent on unnecessary drugs each year with severe health consequences. The truth is, drugs are your last resort for osteoporosis, which even the U.S. Surgeon General agrees with. There are natural steps you can take to avoid the need for drugs, specific targeted exercises, balance training, and the most important is a proper and personalized assessment of underlying causes of bone loss. This leads me to the fourth myth. Osteoporosis is a unique disease. In reality, it is almost always linked to another medical condition that goes undiagnosed. When you identify the underlying cause, you not only build stronger bones, you actually build a stronger and healthier foundation for life. You build a better metabolism so you become leaner, have better blood pressure, better heart health, better energy, better mood, better outlook on life, and many more positive effects. Getting at the related medical issues and underlying causes eliminates many of these negative effects. And the last myth for today is that only women get osteoporosis. The reality is that men are at risk as well as women. Only proper and comprehensive testing can identify who is at risk and when specific actions need to take place to reverse osteoporosis. There are several other myths, but I think you got the big picture. Back to our wife from the story. She was started on our personalized program and she was dedicated to her success. It took her a while to catch on to the program. She asked lots of questions and we were right there with her every step of the way. Within a couple of weeks, she already was breathing easier, felt more confident and stronger. Before long, she was empowered to progress and take care of herself. She became more and more independent. Her investment in herself was paying off in ways she never anticipated. 6 months later, she burst into our office, smiling from ear to ear, clutching her bone density report in her hand. I didn't have to read it to know what it said. I already knew from our own testing that she was improving in strength. Her balance was great. Her VO2 max, the way she manages her oxygen, was at its peak. Her flexibility improved. Her blood labs were better. And every marker was better. She knew how to manage her life in the best possible way. And of course, her bone health was outstanding. Her husband, who was supporting but skeptical, was commenting on all of her positive results. A true success in every way and just one of many. If you want to learn more, get screened for risk factors and get back to the life you deserve and envision, give me a call at our office and we can have a chat. Nothing makes me happier than seeing our friends and family, which is what everyone that we see eventually becomes. Nothing makes us feel better than knowing we were helpful in teaching you how to recapture your health. Knowing that you now have the tools, the knowledge, and take action to live better than ever. Be on the lookout for our expanding osteoporosis program starting November 1st of this year. We only accept a limited number of people so that we can spend enough time, make sure we give you the proper attention, but it's guaranteed to help you succeed and achieve better health and wellness. If you want to be considered for our next class, please give me a call. I'm Dr. Amir. Thank you for listening and stay in good health.